Now let us read and understand about one of the important question in the respiratory system of microbiology, that is diphtheria. Diphtheria in the like we don't need to study everything in order to answer the questions. Like we need to spot the highlights and we need to memorize it. I can understand that microbiology is somewhat difficult to remember and something, but let us try to create some mnemonics. Let us study with fun so that we can remember those things. Let me try my best to make you understand as well as create some funny mnemonics so that everyone can remember. Okay, shall we start? Okay, fine. Let us start with the diphtheria. Diphtheria, it is a respiratory tract infection, and everyone know that it is usually childhood disease caused by Corynebacterium diphtheria. The first thing to remember is the causative agent, that is Corynebacterium diphtheria. Then, okay, Corynebacterium, it states that when primarily infects the throats, and this Corynebacterium diphtheria which infects the throat and produces toxin. Yeah, here one of the important thing to be noted is diphtheria toxin. It causes so many side effects. Let us discuss about that later. So this toxin basically causes the exudative pharyngitis and membranous tonsillitis. In this paragraph, we just need to remember only 4 words, that is Corynebacterium diphtheria, it is the causative agent, diphtheria toxin, it causes exudative pharyngitis as well as membranous tonsillitis. Only these things to be remembered. Then, okay, sometimes they ask the genus basically Corynebacterium, but morphology to be remembered. The first important to be remembered, gram positive, then non-capsulated, non-sporing, non-motile bacillus. Okay, it should be remembered in the microscopy in order to identify the organism, and also it has special thing, that is club shaped swelling. Okay, then this Corynebacteria, this genus Corynebacterium, it has so many different species, but we are particularly talking about diphtheria because one of the severe diseases which can be caused is diphtheria. So when we talk about this Corynebacterium diphtheria, it shows typically 2 characters, that is which makes it different. That is one of that is it forms the cuneiform arrangement. Yeah, V or L shaped bacilli, that is Chinese pattern arrangement. And in the Albert stains, it show the blue metachromatic granules at the end of the green bacilli. 2 things. One is Chinese type of arrangement. Another thing is it shows the blue metachromatic granules at the end of the green. Let us assume this is green, and this will be the blue colored thing, metachromatic granule. So this is about the identification or morphology. Let's see what happens next. This is what Chinese letter cuneiform arrangement. They appear V or L shaped in smear. This is called snapping type of division. One keyword to be remembered, snapping type of division. Then metachromatic granules, those things we have seen. Then here is a paragraph which has given about metachromatic granules. I think we don't have any use with this in order to pass. For the stoppers or for those who are preparing for this competitive exam, it may help that. So coming to the history, it was first observed by Klebs and Loeffler, so it is called KL bacillus, that is Klebs Loeffler bacillus. History, it is only important. Clubs who discovered Clubs and Loeffler. Then, then the important thing goes. That is, what are its virulence factors? Basically, it is not the bacteria. It is said that in diphtheria, it is not the bacteria which causes this diphtheria. It's the toxin, which is famously known as diphtheria toxin. It is responsible. This diphtheria toxin basically has two fragments. It is a polypeptide chain, means protein. It has two fragments, that is A and B. Fragment A for active, B for binding. Fragment B binds to the host cell receptors and helps the entry of fragment A. It is like B, it is a gatekeeper. It binds to the host cells, especially to the host cell receptors, epidermal growth factor. Then it opens the gate and allows the active fragment. So it's a driver, it's owner. Let us remember that kind of thing. See, fragment A is active fragment which causes ADP ribosylation. Okay, A is going to duty. What is the duty of A? It need to do ribosylation of elongation factor 2. Ribosylation of EF2 leads to inhibition of EF2. Means here inhibition of translation of protein synthesis. Endotoxin A, exotoxin. It is exotoxin. A pseudomonas has similar mechanism like of diphtheria toxin. So now we got to know that one of the friend of diphtheria is there, that is pseudomonas. But here we are studying about diphtheria. Then the production of diphtheria toxin is dependent on various factors. One is phase coded, like this bacteria requires a bacteriophase which helps in the production of DT toxin. And okay, in order to produce something, we need some raw materials. So the raw material which is required is the iron. And also we know that this Corynebacterium genus, it has so many species. Some other not only the diphtheria can do, other two members can also do. That is the Corynebacterium ulcerans. We can remember ulcer and pseudotuberculosis. Okay, we know about ulcer and tuberculosis, so these two species name we can easily remember. That is Corynebacterium ulcerans and Corynebacterium pseudotuberculans. Tuberculosis, sorry. This thing we can remember. Then comes the help of toxide. Toxin creates the disease, but toxide is formed from toxin. Now toxin is a raw material. This raw material is used to form toxide. Toxide formation is promoted by either formalin in the acidic pH or prolonged storage of toxin. Toxide is formed from toxin. This toxin becomes toxide when its virulence factor is lost. We cannot directly use toxin because toxin is highly virulent. So some of the vaccines are given, that is Park William 8 strain as a source of toxin and LF unit. This diphtheria toxin is given with the unit of LF unit. This is to be noted, unit of this diphtheria LF unit. Then pathogenesis and clinical manifestations. Let's see. Pathogenesis of diphtheria is toxin mediated. We know that diphtheria toxemia. Diphtheria is a toxemia but never a bacteremia. The meaning of this sentence is this diphtheria which is caused due to the toxin, not due to the presence of bacteria. But the bacilli, they are like papa because they are non-invasive and present only on this local site. But they spread and they release the toxin into the bloodstream and spread to various organs. It is the toxin which is responsible for types of manifestation like respiratory, systemic, skin lesions, etc. etc. Okay. Now let us understand two things. Respiratory diphtheria. Diphtheria, they have mentioned that it causes to respiratory as well as another system. So first we will see what happens in the respiratory diphtheria. The most common form of diphtheria is respiratory diphtheria. See, we heard about in the, like, initially we heard the word tonsillitis and pharyngitis. So this respiratory diphtheria also be called as fusial diphtheria. Most common sites are nose and larynx. And this fusial diphtheria incubation is 3 to 4 days. Let us see what happens in the fusial diphtheria. Diphtheria toxin elicits an inflammatory response that leads to the necrosis of the epithelium and exudate formation. Whenever this toxin attacks, there will be a inflammatory response, as well as there will be a necrosis and exudate formation. This leads to the formation of mucosal ulcers. Mucosa, there will be a pseudomembrane coat composed of inner band of fibrin and surrounded by neutrophils. Wherever there is a inflammation, there will be a, जहाँ जहाँ पे शादी होगा वहाँ पे हम जैसा बैक बेंचर्स होंगे, वैसे ही जहाँ जहाँ पे इन्फ्लेमेशन होगा वहाँ पे न्यूट्रोफिल्स होंगे. So it is so named as it is adherent to mucosal membrane and bleeds on removal. In contrast to two membranes, it is called pseudomembrane because it is not a membrane at all, but it is adherent to mucosal membrane. If it is removed, there might be a chances of bleeding. This is what they said. Then see, the picture here depicts the pseudomembrane. This is what pseudomembrane. And another classical importance, that is bull neck appearance. See, this is the bull neck appearance. Now let's see what happens in the fusial diphtheria. One is the pseudomembrane formation. Then the pseudomembrane not only forms, it extends to larynx and bronchial airways. Okay, here it starts, and then obviously when someone start growing, they will basically extend. There might be the fatal airway obstruction, leads to asphyxia. Then whenever there is itis, we know that inflammation is associated with 5 symptoms. One among them is swelling. So there will be a bull neck appearance. It is characterized by massive tonsillar swelling and neck edema. And also classical symptom is foul breath, thick speech, and noisy breathing. Now let us see cutaneous diphtheria. This cutaneous diphtheria presents as punched out ulcerative lesions. We know different types of ulcer. One among is punched out ulcerative lesion, and we know that there is necrosis and rarely pseudomembrane formation, because cutaneous is associated with the skin, and that fusial diphtheria is associated with respiratory tract. Cutaneous diphtheria is due to organism itself. This cutaneous diphtheria is not from the toxin, but it is from the organism itself. जहाँ पे हमारा घर है वहाँ पे हम कुछ कर लेते हैं. वैसे ही जो बैक्टीरिया हम क्यूटेनियस, मतलब जो बैक्टीरिया ऑन द क्यूटेनियस रीजन जब घर बनाते हैं तो वह कुछ पकाते हैं ना. That's the thing. Cutaneous diphtheria is due to organism itself. Hence, it is possible that the skin lesions may also be caused by non-toxigenic strains. Now comes systemic complications. क्या क्या होगा systemic complication? It has polyneuropathy related to renal system, myocarditis related to cardiac system. Other complications include neurological manifestation, क्योंकि cranial nerve involvement है, peripheral neuropathy है, ciliary paralysis है, and myocarditis. Itis means inflammation. It is typically associated with arrhythmias and dilated cardiomyopathy, neurological manifestation, and myocarditis. Then Everyone's favorite question: laboratory diagnosis. Since it is a bacteria, we know that we already know it's a gram positive bacteria, so हम सबसे पहले ना ग्राम स्टेन कर लेते हैं. और वन मोर थिंग, we need to see the metachromatic granules, so अल्बर्ट स्टेन्स कर लेते हैं. देन कल्चर मीडिया. बैक्टीरिया है. जब भी बैक्टीरिया होता है देयर विल बी ग्रोथ ऑफ बैक्टीरिया. बैक्टीरिया कैन बी कल्चर्ड. सो कल्चर्ड मीडियम ये जो है ना, ये सब ह्यूमन्स रिलेटेड है ना. सो बेसिकली ब्लड. ह्यूमन ने क्या होता है? ब्लड. ह्यूमन को क्या चाहिए होता है? चॉकलेट. देन वन मोर इम्पॉर्टेंट थिंग, द सेलेक्टिव मीडियम इज पोटेशियम टेल्यूराइट अगर and Tinsdale medium. Both produces black colonies. This is to be noted. Blood agar, chocolate agar, and Loeffler's serum. So we already know that it is, its name itself called Klebs Loeffler's bacillus. इसलिए तो भी लोफलर्स को क्या बोलते हैं? लोफलर्स को थोड़ा इज्जत देना पड़ेगा. इसलिए लोफलर्स सेरम्स लोग भी हम कर सकते हैं, यूज़ कर सकते हैं. देन आइडेंटिफिकेशन के लिए हमेशा बायोटेक्स, इसमें ना शुगर फर्मेंटेशन टेस्ट होता है. एंड इस सेरम शुगर मीडिया, शुगर फर्मेंटेशन टेस्ट याद रख लेते हैं. ऑटोमेटेड में हमेशा मोल्ड ऑफ बायोटेक. और कुछ और एक्स्ट्रा टेस्ट होता है कॉमनली एलिसा PCR. ओके, एल्क्स प्रेसिपिटेशन टेस्ट. इसको हम थोड़ा देख लेते हैं क्योंकि इट्स ए 3 मार्कर क्वेश्चन. देन लैबोरेटरी डायग्नोसिस, सिंपल थिंग इज ओवर. देन लेट्स सी व्हाट एल्स. ओके, आइसोलेशन कैसे करते हैं? सबसे पहले ना थ्रोट स्वैब, जहाँ जहाँ इन्फेक्शन है वहाँ वहाँ लेते हैं. ग्राम स्टेन लेते हैं, वहाँ पे हम चाइनीज़ पैटर्न देखते हैं. अल्बर्ट स्टेन लेते हैं, वहाँ पे ब्लूइश ब्लैक मेटाक्रोमेटिक एनरिच्ड मीडियम. एनरिच्ड मीडियम में ना ब्लड अगर कॉलोनीज स्मॉल सर्कुलर होके, या लोफलर्स को थोड़ा इज्जत देते हैं. कॉलोनीज अपीयर एज स्मॉल सर्कुलर ग्लिसनिंग एंड वाइट येलो इन 6 to 8 hours में. स्मॉल सर्कुलर ग्लिसनिंग. सेलेक्टिव मीडियम में क्या होता है? पोटेशियम टेल्यूराइट अगर में हम देखें ना, ब्लैक कलर कॉलोनीज. देन बायोकेमिकल टेस्ट, शुगर फर्मेंटेशन टेस्ट. शुगर फर्मेंटेशन टेस्ट में क्या होता है? दिस इज द ब्लैक कलर्ड कॉलोनीज इन द पोटेशियम टेल्यूराइट अगर. दिस इज इम्पॉर्टेंट. एल्स जेल प्रेसिपिटेशन टेस्ट वी नीड लिटल डीप में देख लेते हैं. दिस एल्क सेल प्रेसिपिटेशन टेस्ट में 4 बैंड्स होता है. 1 क्रॉसओवर बैंड्स, स्पर फॉर्मेशन, फ्यूजन ऑफ बैंड्स. दिस एल्क सेल प्रेसिपिटेट टेस्ट इज डन ऑन द हॉर्स सीरम अगर प्लेट. देयर विल बी 4 डिफरेंट काइंड्स ऑफ आइसोलेट्स. मीन्स जब भी बैक्टीरिया होते हैं हमेशा एक ही तरह नहीं होता. नॉट ऑल आर सेम. देयर विल बी डिफरेंट बैक्टीरिया एंड डिफरेंट थिंग्स. सो if we talk about crossover bands, the precipitant bands crossed over indicates toxins are not identical, therefore strains are unrelated. क्रॉस बोलते हैं रिजेक्शन, मीन्स दोनों ने रिजेक्ट कर लेते हैं, मीन्स दे आर नॉट डिफरेंट स्ट्रेट्स. और पार्शियल फ्यूजन बैंड्स, स्पर फॉर्मेशन, इट्स लाइक ओके. It is pura like cross band over a spora rejection, and spur formation is like, let us say it's situationship. But pura fusion होता है ना, ये होता है commitment. तो the precipitation bands fused with each other indicates identical to each other and the strains are completely related. And जब भी हमेशा single boy is always cool. So ये कुछ नहीं कर सकता है. मतलब देर विल बी नो टॉक्सिजेनिक स्टाइल व्हेन ही इज सिंगल। तो सबसे पहले ना क्रॉसओवर ब्रेकअप हो जाता है, बाद में स्पर फॉर्मेशन होता है, मतलब वो सिचुएशनशिप में रहता है, बाद में फ्यूजन ऑफ बैंड्स। इतना तो याद रख सकते हैं। देन इसमें ना एपिडेमियोलॉजी में क्या याद रख सकते हैं हम? सोर्स कैरियर्स होता है बेसिकली, थ्रोट स्वैब। ट्रांसमिशन होता है रेस्पिरेटरी टैबलेट्स, सॉरी रेस्पिरेटरी ड्रॉपलेट्स, कॉफिंग, स्नीजिंग। ह्यूमंस आर द ओनली रिजर्वियर। हमेशा ये याद रखना, एज्ड 1 to 5 चीज with widespread immunization. Situation: more than 95%. From the past 30 years, it has been decreased by 95% because of the introduction of vaccine DPT. Then nothing much required here. ओके, ट्रीटमेंट तो सबसे ज़रूरी है एंटी टॉक्सिन कैन बी गिवन। ये एंटी टॉक्सिन क्या होता है? सबसे पहले ना बिफोर गिविंग दिस एंटी टॉक्सिन वी नीड टू चेक फॉर हाइपर सेंसिटिविटी। देन अर्ली स्टेज में मतलब लेस देन 48 आवर्स में 20 to 40,000 यूनिट्स देना है। पेरेंजियल मेम्ब्रेन, वो स्यूडो पेरेंजियल मेम्ब्रेन था ना जो यहाँ पे, देन वी नीड टू गिव 40 to 60,000 यूनिट्स। इन द लेट स्टेज, बुलनेक स्टेज में 80 to 120, 20 to 40, 40 to 60, 80 to 120, ये याद रखना है। बुलनेक तो हाई पावर होगा, तो ये भी दे सकते हैं। ये है एंटीटॉक्सिन। लेकिन सबका दोस्त भी है यार हमारे पास, पेनिसिलिन और एरिथ्रोमाइसिन। इट इज़ द ड्रग ऑफ चॉइस। पेनिसिलिन जो है वो बैक्टीरियोस्टैटिक एजेंट है, जिनको है वो ग्रोथ ही नहीं देता है, ग्रोथ ही नहीं होने देता। सो कैरियर्स के लिए एरिथ्रोमाइसिन, जिनको इफेक्ट है उनके लिए पेनिसिलिन दे दिया तो चला गया। देन प्रोफाइलैक्सिस, वैक्सीनेशन इज़ मतलब 3 मार्क्स में या 5 मार्क्स में आ सकता है, तो उसके बारे में थोड़ा कुछ पढ़ लेता है। डिप्थीरिया टॉक्साइड इज यूज्ड फॉर वैक्सीनेशन एज इट यूज्ड। ओके, टाइप्स ऑफ वैक्सीन्स, सबका फेवरेट सिंगल वैक्सीन, कंबाइंड वैक्सीन। सिंगल वैक्सीन में क्या देते हैं? सिर्फ डिप्थीरिया टॉक्साइड देते हैं। टॉक्साइड कैसे बनाते हैं? यूजिंग फॉर्मेलिन, वहाँ पे पढ़े थे। और कंबाइंड वैक्सीन्स तो है DPT, DAPT। DPT क्या होता है? डिप्थीरिया पर्टुसिस टेटेनस। तो यहाँ पे ना पर्टुसिस अर्जुवेंट जैसे वर्क करता है। अर्जुवेंट वन ड्रग इम्प्रूव्स द स्ट्रेंथ ऑफ अनदर ड्रग विच इज़ द रेड इन फार्माकोलॉजी। उसको छोड़ना। डिप्थीरिया पर्टुसिस टेटेनस, डिप्थीरिया असेल्युलर पर्टुसिस टेटेनस, DPT, DAPT, TD। TD is well known in OBG। एंड पेंटावैलेंट वैक्सीन। ओके, डिप्थीरिया वैक्सीन का शेड्यूल तो थोड़ा कुछ देख लेते हैं। हमेशा ना वैक्सीन यूनिवर्सली 6, 10, 14 सबका फेवरेट नंबर है। बाद में 2 years, बाद में 5 years। सो हम ऐसे याद रखते हैं 6, 10, 14 +4 बाद में सीधा 2 + 2 5। देन प्रेग्नेंट वुमेन को TD देना ही है, लाइक 1 month इंटरवल। साइट कहाँ पे? ओके, TD तो देना है। कहाँ देना है? इंट्रामस्कुलरली देना है। स्टोरेज 2 to 8 डिग्री सेल्सियस। ओके, This is what we can read and remember about diphtheria and frequently asked question. Let's meet with the another video.